One challenge that therapists have who work with patients with mild cognitive impairment is that by the time the therapist sees the patient is sometimes on information overload. They've been seen by a series of specialists and perhaps don't realize exactly what's going on with them. As therapists, it's our job to figure out what is going on, as well as explain to patients how to help them, how we can help them. I've started this channel to help provide assessment and intervention strategies to help this population improve their attention, brain speed, executive functioning, memory, and language skills. I have 14 years experience working at the university setting, as well as 5 years in private practice, specializing in cognitive rehabilitation. I'm hoping that you would like to become a part of my community and join my channel so that I can share this knowledge with you to better help your patients. Thank you very much. Therapy can take advantage of neuroplasticity. Neuroplasticity is the brain's ability to rewire itself. Therapy provides cognitive stimulation. And cognitive stimulation has been shown to reduce the onset of dementia in patients with early stage mild cognitive impairment. Mild cognitive impairment, also known as MCI, is a concern of performance problems over one or more domains of cognition. The main areas of cognition are attention, language, memory, executive functioning, and visuospatial skills. MCI is sometimes a precursor to dementia, but sometimes it is not. 10 to 20% of people in the population of 65 and above have mild cognitive impairment. Therapists, like speech-language pathologists, of which I am one, and occupational therapists provide cognitive stimulation. It provides patients with evidence-based practice to improve their cognitive functioning. It stimulates neuroplasticity. Neuroplasticity is the brain's ability to adapt as a result of experiences. Certain types of stimulation cause neuroplasticity. SLPs can provide programs to stimulate neuroplasticity through process and strategy training. The strategy training and stimulation are depicted here in this diagram, where I'm showing you attention, language, memory, and executive functioning. I'm showing that there is strategy training as well as stimulation training that affect neuroplasticity. So in the area of attention, we're looking at self-instruction as far as a strategy, and stimulation would be maintenance of increasing attention and duration. In the area of language, strategy would be categorization, and stimulation training would be word completion exercises. In the area of memory, strategy training would be visual association, and stimulation training would be working memory exercises that affect cognitive flexibility. And then in the area of executive functioning, strategy training would be planning complex tasks and self-monitoring tasks in the form of exercises. In the area of stimulation training, we would have verbal, logical reasoning, and topographical planning and problem solving. In the area of attention, so I want to talk a little bit about detailed areas of treatment. These are examples of treatment in these domains. So this is attention, and a restorative treatment is also known as your stimulation training. An example would be an in-back exercise. A compensatory strategy training would be PQRST, which is preview, question, read, state, and test. In the area of memory, restorative treatment would be, an example would be errorless learning, which is minimizing errors by breaking down skills into manageable chunks. Modeling how to do the skills, requiring the patient to do the skill and giving feedback immediately, and also fading the prompt over time. Another example would be space retrieval treatment, where the patient does the skills with a high degree of targeted accuracy with increased time between intervals. Examples of the intervals would be 1 minute, 3 minutes, 10 minutes, and 30 minutes. Under compensatory strategies, a goal would be to compensate for weakness that is not beneficial to retrain. Examples are mnemonics and cognitive restructuring. Language treatments include response elaboration training, where you are cueing a patient to elaborate to support contribution to conversation. Semantic feature analysis, identification of semantic features of a photograph. As you can see on the right-hand side, there's a photograph with 6 feature questions, stems of questions that are going around in a circular pattern, pretty much starting with it's a, you use it for, it does, it reminds me of, you find it, and describe it. And what you're basically doing is helping a patient have a cue, a visual cue of a way to think of the features associated with the photograph. Verb network strengthening, known as VNS, where a patient is completing a verb, they're adding a verb into a sentence. Language treatments include constraint-induced language therapy. That's treatment focused on intensely encouraging use of language to communicate, and then melodic intonation training, where you're using music to improve expressive communication, to engage the right side hemisphere. Patients sing words they want to communicate and increase the length of the utterance over time. Language treatments also include multiple oral reading, where the patient is asked to read aloud to improve their fluency and speed. And it's best for patients with preserved letter-to-letter ability. Oral reading for language in aphasia. Repeated practice reading sentences aloud with connected discourse sentences, and then supported reading comprehension, incorporating enjoyable text support and linguistic supports. Also, word retrieval cueing strategies, providing beginning sounds or contextual cues to encourage recall of the word. Lastly, communication partner training, providing emotional support using positive question style and collaborative turn taking. Executive functioning in the area of restorative treatment is dual task training, 2 tasks being completed simultaneously. Tasks that involve cognitive and motor skills is an example of this training. Also, computer-assisted treatment, software designed to engage executive functioning skills, for example, decision-making, sequencing, and planning. Compensatory strategies include metacognitive skills training. Patients set goals and moderate behavior through self-evaluation. Also, external aids, calendars, logs, and physical organizers helps with the management of activities. Internal aids, using positive self-talk and questions as an example in the form of strategies like PQRST to take a deeper look and increase learning. Thank you for watching. Please subscribe to my channel. I will be putting forth a newsletter, and I would like you to receive it, so please click the link below.